And as we navigate the pandemic, doctors are reminding everyone not to put off health screenings.
And that includes colonoscopies. We're learning why it's so important in this week's medical moment.
One of the ways to be healthy is to get your screening procedures for cancers that can be prevented. And one of those that's very preventable is colorectal cancer.
It doesn't have a fun reputation, but colonoscopies save lives.
It's the second leading cause of cancer death in men and women, and 60% of the cancer deaths that we see from colorectal cancer could have been prevented if the patient got a colonoscopy in a timely manner.
Dr. Randall Meisner, a gastroenterologist with Spectrum Health, says colorectal cancer can be prevented. He says a colonoscopy is the preferred screening test for colorectal cancer.
That is the best test to get for an average risk patient that is healthy enough to get it.
Patients can also get a CT scan or have a stool sample tested if they're not healthy enough for a colonoscopy. Dr. Meisner says the current recommendation is to get screened starting at 50 years old, but for some, it may be sooner.
If you have a family history of colorectal cancer or somebody in the family who had a large polyp, or if you are having symptoms of bleeding or change in bowels or abdominal pain, we're gonna want to do that exam sooner.
And if you're nervous about stepping into a healthcare setting due to COVID-19, Dr. Meisner says staff and patient safety is their #1 priority.
Our staff are screened daily for COVID. We are protected with proper PPE, face masks, face shields, gowns, gloves. Our visitors are screened daily, and our patients are screened for COVID as well.
Now, to schedule your screening or learn more about your options, you can visit spectrumhealth.org/colonoscopy. You can also call the number right there on your screen.